Hello, my name is Dr. Maggie Kreher. I'm a palliative care physician in the Department of Family and Community Medicine, Division of Geriatrics and Palliative Care at the Thomas Jefferson University Hospital. I am also a member of the interprofessional team at the Weinberg ALS Center at Thomas Jefferson University Hospital. It's my great pleasure today to speak with you about advanced care planning. My goals are simple: to review why advanced care planning is important, to review the importance of a good discussion with your care providers and loved ones when doing advanced care planning, to review the types of advanced care planning documents available, and to provide you with some resources for advanced care planning that you can use to do advanced care planning at your own pace. And with that, we will get started with our slideshow. Why is advanced care planning important? It's really about the care you would want in medical emergencies. It's to guide your loved ones or proxy decision makers if and when you are not able to make decisions on your own. Advanced care planning provides clarity and peace of mind to you and your proxy decision makers. Most importantly, advanced care planning involves conversation with your loved ones, proxy decision makers, and your healthcare providers. Any documents support that conversation. Take advanced care planning at your own pace, and you can certainly change your mind as time goes along. It is important to remember to try to avoid crisis management because in ALS or in any setting, emergencies can happen. Knowing preferences and goals for care ahead of time assists healthcare providers in providing care in alignment with your preferences and goals. Your healthcare team may suggest interventions to support your goals and quality of life based upon your symptoms and clinical assessment. At each visit, specific types of impairment are assessed, such as in breathing and swallowing. There are non-invasive procedures and techniques, and there are invasive procedures and techniques involved in supporting the efficiency of your breathing and effectiveness of your swallowing. Non-invasive procedures can include positive pressure masks for breathing, especially at night or when sleeping, and non-invasive procedures such as dietary consistency changes to allow more efficient swallowing. Invasive procedures include tracheostomy, and I've included a picture of that here. A tracheostomy is a surgical procedure that places a tube through your neck into your main breathing pipe or trachea. Tracheostomies are usually designed to support chronic ventilation. Other invasive surgical procedure includes feeding tube placement, and a feeding tube placement is a surgical procedure where a tube is inserted through your abdominal wall and into your stomach so that you may receive liquid nutrition to maintain your calorie intake. As with most medical decisions, if not all medical decisions, it's important to consider risks, benefit, and burdens. What is the risk of the procedure? What are the side effects? What are the long-term side effects? What are the benefits of the procedure in regards to my quality of life, goals for care, personal goals? And what are the burdens of the procedure or intervention that can impact my day-to-day quality of life and day-to-day support needs? But every healthcare decision is personal and individual. Your healthcare team is there to provide expert advice, guidance, support, recommendations based upon all of the considerations of what's important to your quality of life, your goals for care, and your personal goals. And remember, knowledge is power to make the best decisions to support your goals. Collaboration with your healthcare team is key. Your decisions and goals may change over time. Conversation about your goals and values and views on quality of life with your family, friends, and support network is really the most important aspect of decision making. You need to provide guidance to your designated decision makers if you're not able to participate in healthcare decisions. it's important to understand the language surrounding advanced care planning documents. A living will is a document which states specific wishes for care at the end of life. A healthcare power of attorney is a document that designates a person to make medical decisions on your behalf. This person is only responsible for decisions if you are unable to make decisions on your own, or if you designate this person to make your healthcare decisions. A POST, or that's Pennsylvania Order for Life-Sustaining Treatment, is a set of specific orders signed by a healthcare practitioner and a patient or their healthcare power of attorney reflecting preferences for care at the end of life. An out-of-hospital DNR order is a document that is a medical order signed by a physician which applies outside of the hospital. And this is usually to not administer CPR in the event of cardiac arrest. Some facts about advanced care planning documents. Most of us in this country think that having our wishes documented is important or extremely important. However, a minority of us ever really document anything. But what studies do show is that family members who are asked to guess what a loved one's decision would be were accurate 50% of the time. However, studies have also shown family members who needed to make decisions on their loved one's behalf in the setting of a living will document had less stress around decision-making than those family members whose loved one did not have a living will. In essence, living will documents assist families have the least amount of stress around medical decision-making at the end of life. There are many types of advanced directive documents available. There is the 5 wishes document, and I will review that with you. There is the POST form, or orders for life-sustaining treatment. Most states have their own POST form, and it is a physician order set signed by the patient or their proxy. mydirectives.com is an online site that can provide online documents for you to download. A living will, every state has its own state-compliant living will form. There is a website called caringinfo.com that is an excellent source for advanced care planning and serious illness. This is the cover page for the 5 wishes document, and the 5 wishes are: the person I want to make decisions for me when I can't, the kind of medical treatment I want or don't want, how comfortable I want to be, how I want people to treat me, what I want my loved ones to know. This document is considered a legal document in most states, not all, but most. It is a proprietary document, and you can go online and order one. It will cost you some money to download or have it sent, mailed to your home. This is a copy of the Pennsylvania Orders for Life-Sustaining Treatment, and as you look at it, you can see it's fairly complicated, but it does address specific medical interventions such as CPR, medical interventions when you are acutely ill, antibiotics, artificially administered hydration and nutrition. And it is signed by your physician and yourself or your healthcare proxy. The legal requirements for writing advanced directives include age over 18. You need to have capacity to make medical decisions. Most living will documents are legally recognized after you sign in the presence of a witness, only if you want them to be. The emergency medical technician's recognition of living wills and POST varies state to state. In Pennsylvania, emergency medical technicians must honor an out-of-hospital DNR. There is also state-to-state variation in terms of living will documents. Use your state-compliant documents if you find that easiest to do. Remember, your written directives do not expire. You can always revoke or destroy, and you can always change them. And also remember, as long as you're able to make your own decisions, you can make decisions that are different from your living will or other written advanced directive document. First and foremost in advanced care planning documents is to determine a healthcare proxy or a healthcare power of attorney. It is wish one from the 5 wishes document. A healthcare power of attorney should not be your doctor or other health provider or a person related to your doctor or your health provider. Your healthcare power of attorney would go into effect when you're not able to make decisions on your own, or if you have designated that person to act on your behalf. Again, I cannot stress the importance of discussion to discuss the role your chosen proxy has and discuss your views about care goals. Because your healthcare proxy may be asked to make decisions about life-sustaining interventions, surgeries, medications, such as starting or stopping them. Your healthcare proxy may be asked to provide consent to transfer to assisted living facility, hospices, for example. And your healthcare power of attorney is allowed to legally represent you in health-related matters. Other directive documents to consider are CPR, or what is known as a DNR, traditional standard directives, or living will stay if I have irreversible brain damage or am permanently unconscious or irreversible vegetative state, then I would want my care to flow this way. However, many end-of-life situations don't involve those 3 scenarios. And again, the conversation you have with your healthcare proxies or loved ones is paramount to good decision-making at the end of life. And again, in ALS, invasive medical decisions may involve feeding tube placement and tracheostomy placement. Advanced care planning relates to the decisions you make to support your goals and quality of life. It involves conversation with your loved ones and healthcare providers. A living will reflect your choices. Healthcare power of attorney designates your healthcare proxy to make healthcare decisions when you cannot. And a post or similar form is an order set signed by the patient and the healthcare provider outlining medical interventions to be provided at the end of life. But remember, care planning is mostly a discussion about living, how you want to live to support the best quality of life to achieve your goals. Your ALS Team Focus is to help you achieve the best quality of life and help you meet your goals. This focus is consistent with the philosophy of palliative care. Your ALS team is your palliative care team. These topics are tough to discuss and require time. There are many online resources out there to help provide a framework and to allow you and your loved ones to think about these things outside of the office or hospital. You can check out certain online resources such as youralsguide.com, 5wishes.org, eforms.com, which has downloadable living wills and DNR forms that are state compliant, and caringinfo.org, which is a great resource for having discussions in serious illness and provides links to state living will and healthcare power of attorney forms. I would like to thank you for your attention today, and I would like to thank the ALS Association for inviting me today. I hope you all have a great day.